Back pain is a very common complaint amongst patients who we see in our clinic. There's a lot of anatomic structures in the low back that can contribute to or cause the patient's pain. We can either attribute patients' low back pain to the joints of the low back, the nerves that are coming off of the spinal cord in the low back, the muscles of the low back, the discs in between the bones of the low back, or even the bones themselves in the low back. Each of these structures has their own unique treatment to target that particular structure as it contributes to the patient's pain. A lot of low back pain, neck pain, joint pain is predominantly a consequence of use, and certain patients have genetic predispositions to having advanced arthritis or early age onset of degeneration in their spine. This can also be caused by poor ergonomics or poor posturing, positioning throughout life in various activities, or when in particular engaging in more strenuous activities. And over time, these what may seem as smaller injuries over time can slowly progress and develop, and the deterioration in the spine also then progresses over time until it begins to cause a problem for a patient or cause worsening of their pain. The best way to really assess which of these structures is contributing to the patient's pain would be by understanding very well in a detailed manner what is the patient's pain like, what does it feel like, what is the history of it, how long have they been dealing with it, what kinds of things worsens their pain, what kinds of things improve their pain, what have they tried in the past for their pain, have they had surgery before. All of these considerations go into understanding what could be contributing towards the patient's pain. Next, we perform a very detailed physical exam to then again focus in on each of these structures to see which one could be causing the patient's pain. Patients who have pain stemming from the joints of their back may complain of like a constant aching, dull, nagging type pain that spreads across their low back, potentially into their buttocks and hips. Usually in these patients, they may have done a lot of heavy lifting either through their work or recreationally, and that's caused a lot of strain on their low back. Patients who have pain caused by the nerves of their low back may describe an electric, sharp, shooting type pain that spreads from their low back down their legs into their toes, may be associated also with numbness, tingling, that type of sensation, or weakness. All of these may be attributed to pain that's caused by nerve compression in the low back, and ultimately all of these pains originate from a degeneration of the discs in between the bones of the low back. This degeneration or deterioration of the discs in between the bones of the low back is usually the starting point for patients to develop pain in their low back. All of the consequences of that, including arthritis in the joints of the low back or inflammation in the joints of the low back, can eventually start to cause tightening of the space in their low back, particularly around the nerves, whether in the spinal cord or coming off the spinal cord, and that can be very painful for patients. Regardless of what the cause of the patient's pain is, we combine their personal history of pain along with our physical exam findings and obtain advanced imaging, whether that be MRI, CT, or X-ray, to identify the structures that are causing their pain, and then in a very targeted way provide interventions or procedures to help alleviate the pain that's caused by those structures.